Okay, so today we're going to be talking about dizziness, vertigo, Meniere's disease, labyrinthitis, and vestibular neuritis. And we're going to be talking about mainly uh, the little differences in between each of these diseases that affect the ear. So, first of all, we're going to be talking about positional vertigo. Now, positional vertigo is when a granular mass that sits on the copula in the inner ear pushes the cilia or the hair on the sensory cells down. Now, certain positions, such as when your head bent forward or when your head is upright, uh, will push the cells more, which essentially produces vertigo. And we're going to be talking about cholesteatomum. Now, this is a benign tumor-like lesion, which can destroy the middle ear this time instead of the inner ear, and it occurs in the setting of chronic otitis media. Now, here's a little visual representation if you guys like to see. And it is important to note that it can cause ear discharge or conductive hearing, or even both, in the affected ear. Moving on, there is vestibular neuritis and labyrinthitis. Now, vestibular neuritis is actually a sudden attack of the vertigo, and it does cause an inflammation of the vestibular portion of the cranial nerve 8, and treatment is meclizine. For labyrinthitis, uh, there's actually an inflammation of the labyrinth in the inner ear this time, and this can cause hearing loss and tinnitus. Now, when it comes to what makes them different, now neuritis and labyrinthitis, they both usually cause viral inflammation of the inner cavity, but when it comes to vestibular neuritis, it is basically an inflammation of the nerve, which is a sudden onset vertigo, so it can go from hours to days, and it can also cause nausea and vomiting. However, vestibular labyrinthitis is an inflammation of the inner ear slash labyrinth. Now, it is the same symptoms as neuritis, and it does have autologic symptoms, but it can also cause hearing loss. Moving on, we have Meniere disease. Now, Meniere disease is actually going to cause vertigo, tinnitus, and fluctuating hearing loss, non-triggered by positional change. So whether you are upright or you are head bent forward, this will not cause a change. Statistically speaking, it generally starts between the ages of 40 to 60, and in 10% of patients, there will be Meniere's in both ears. Now, when it comes to how it feels, the patient will generally feel like the ear is completely blocked off, or there's a lot of pressure filling up the ear. Next is presbyocusis.